News on 710 KURV. Some people already suffering because of the warmer weather around here. Seems that things are blossoming and blooming left and right. And you know what that means. The scratching of the noses and the watery eyes and people sneezing all over the place. That's right, it's allergy season again. We're in one of the worst places of the country when it comes to allergies. Did you know that? Dr. Al Johnson with Johnson Medical Associates, my guest right now at 710 KURV. Dr. Al, welcome back to the show. How are you?
Good morning. I'm just fine.
So is there anything we can do right now early in the season? I know it's kind of still winter in some other parts of the country, but for us it's always nice and warm and things are growing down here. And that's probably one of the reasons we're one of the worst places for allergies in the country. Anything we can do to mitigate, some of the symptoms early on?
Those people with allergies, of course, probably recognize it in that their eyes itch, their nose runs, and sometimes they just feel bad, get tired, fatigued, trouble thinking, concentrating, and all the symptoms that allergies can cause. And one of the things that you have in your area year-round is mold, and when the wind picks up and the weather changes occur in the spring, of course, the winds are higher, and then the mold count jumps up, and people start to have trouble with their symptoms and the mold. The best thing to do is turn on your air conditioner, keep your windows closed, so you reduce your exposure, and make sure you have high-efficiency filters on your house. Then, if over-the-counter medications are not working, such as the non-drowsy allergy medicine, then you need to see your doctor and figure out what's going on and what's the best way to treat it more aggressively.
Okay, can you explain the process of an allergy? What is the body doing? What is the allergy?
There's different types of allergy. The most common that we consider is what we call IgE allergy, which is type 1. And that's where your body is exposed to something that it does not like, it has built up a sensitivity to, and it causes a release of histamine and inflammatory factors, and which causes swelling, the mucous membranes to react and secrete secretions with your nose running, your eyes watering and tearing, and then the histamine causes your skin to itch, even causes hives where you get little bumps on your skin that are raised and itch intensely.
Is there any way to introduce one of these foreign substances into the body to get it used to it, and that way the reactions is not that severe? Some type of vaccine?
Yes, exactly, and that's what the people that treat allergies do, and what I do in my office all the time is look at long-term solutions to find what you are sensitive to by skin testing, and that's using small purified amounts of the different items that people can be sensitive to, find out what they are sensitive to, and then you use allergy immunotherapy on a repeated basis. In other words, you give small doses, which is the best tolerated dose, to the individual on a routine basis, and you build up what we call blocking antibodies. You build up tolerance to those substances.
Joining us on 710 KURV from Johnson Medical Associates, we're talking about allergies and allergy season, what you can do to protect yourself or mitigate some of the symptoms. At what point, Doc, do people need to go see a specialist? One thing is taking antihistamines, but at some point, maybe after many weeks or is it possible for people to be bedridden with symptoms related to allergies?
Well, there's some people that have, very severe allergies that they have a hard time going outside. They just have a really hard time functioning. Yes, they end up in bed. Some of these people are those people who've had mold in their home and actually have been exposed over a long period of time to mold and become very, very sensitive to it. And actually, some of the black mold produces toxins, which are nerve toxins, and affects their nervous system, their ability to function. I see those people all the time to help them to understand better what is going on, how to get them treated, because that's much more difficult than just the standard seasonal allergy, which is trees, grasses, weeds. Trees and grasses are in the spring mainly, fall or weeds, and then mold tends to be year-round, and then, of course, you have dust mites, which are inside all year-round.
Dr. Johnson, it's a pleasure. Thank you much for joining us, sir. Dr. Al Johnson from Johnson Medical Associates, our guest on 710 KURV.